thank you right now for joining us. You are in attendee mode, so you will not be able to turn on your mic or camera, but any questions or comments you can certainly share in the chat box, and we'd be happy to address those as we go. So just give us another minute or so and we'll get started. Okay, so what we will do now is we will get started. My name is Richard Storney. I'm the Executive Director and Chief Operating Officer of the AAFD, and welcome to Meet the Expert webcast series. Our webcasts are brought to you by our supplier network of experts and aimed at empowering businesses like ours and yours with timely education, practical tips, and trusted guidance. The format's going to be about 30 minutes of presentation, followed by 15 minutes of question and answer. Again, if you didn't hear me in the beginning, questions will be provided through the chat box from you. So if you have a question on a particular slide, I would suggest just typing it in the chat box at that point. We'll answer the questions at the tail end of the presentation itself. And also note that the presentation itself will be recorded so that you can reference it after the fact, and certainly for anyone who was not able to join us live today. So without further ado, I'm going to pass over to Lori, who's going to do the introductions more formally. Here you go, Lori.
Hello, my name is Lori Hickel, and I'm a chapter coordinator for the AAFD. Today's webcast is Telehealth One-on-One. How can telehealth be beneficial to your company and employee retention? Our presenter today is Kelly Foley, President of Convenient Care Plus, a membership plan available through the AAFD Health Benefit Program. The AAFD recognizes that finding affordable health care for yourself, your family, and your employees can be difficult. That is why our AAFD Health Benefits offers a suite of valuable options to fit any budget and needs. Kelly, welcome. Thanks for taking the time today.
Thank you, Lori. Appreciate the introduction. I'm going to go ahead and just get started here. I'm going to share my screen. So hopefully you can all see what I see here shortly. Okay. And I think get acknowledgement that that is what you see there,
Yes,
the first slide.
We do see your first screen. You're all set.
All right. Well, first, I'd just like to say thank you to Richard and Lori and the AAFD for the opportunity to spend some time this morning talking about telehealth, telemedicine. We really think that it's a unique opportunity for mid to small size franchisees to offer a really valuable benefit to their employees. What I want to do today, I want to just start by talking about telehealth, telemedicine, and the advantages employers are experiencing by offering the affordable benefit to their employees. I'm going to start this by really covering the definitions. And you'll see right away when we look at the definition of telehealth, sometimes called telemedicine. Ironically enough, these are interchangeable terms for the most part. Telehealth is described as the practice of providing healthcare remotely by the means of telecommunication. And when we look at the definition of telemedicine, right away we see that it says sometimes called telehealth. Obviously, explaining the fact that many people use these terms interchangeably, but bigger picture is telemedicine is really the remote diagnosis of patients by the means of telecommunication for more minor illnesses. So telehealth, the way I look at this is when you hear the word telehealth and telemedicine, I don't put a lot of stock in one or the other just because people use them so interchangeably. It's not really right or wrong. If you want to get really technical, telehealth really describes the healthcare delivered by telecommunications. Whereas, it can mean delivering things like we're doing today, education. That can be described as telehealth. telemedicine is really like clinical diagnosing of minor illnesses. So if that makes sense to all of you, you can kind of say that you know the difference between telehealth and telemedicine, but at the same time, you'll hear them used interchangeably. So I'm going to use telehealth just because we're doing some education today on it, but know that really they mean very similar things. And the biggest thing is when you are all out there looking at benefits and you see the word telehealth or telemedicine, know for the most part, again, those terms mean the same things when we're talking about healthcare benefits. Now, the one thing I do want to talk about in the way of definitions and really helping everyone understand, people sometimes think if they're looking at a telehealth or telemedicine benefit that, wow, this one costs X amount of dollars per month, while another one might cost quite a bit more. And you think, well, if they're all the same, I'm going to go ahead and maybe look at the one that costs less. The one thing I want to really point out and educate on is when it comes to telehealth, there's access and then there's true benefit. And I'll explain that by just looking at the slide here. Access to telehealth means that there's a lot of companies out there that charge a very small, and we call it a PEPM, a per employee per month fee. So let's say you have 10 employees and the fee is $20 a month. You can do the math and you think, wow, that's really inexpensive. But you really need to understand, are you getting access or are you getting benefit for that $20 per month? And so we'll look at the example here. A lot of telehealth will say it's $20 a month, but then when you call the number, you will be told that you need to pay $29.99 or maybe $39.99. And I've also seen it all the way up to $99.99 for the actual doctor consultation. Okay. So when you think you have telehealth benefit and you call that number and you're told you need to spend money for that consultation to talk to the doctor, that is in fact telehealth. And that is still a big convenience because you're not having to travel, not taking time out of your day to make an appointment, that you're able to do it from the comfort of your own home or perhaps your office. And there are a lot of benefits and advantages to that type of telehealth. But it is much different than if you receive a benefit when you pay for your telehealth. So let's say for that same $20 a month, you have a plan that once you call, you get connected to a doctor at no additional fee. So there is telehealth out there that we consider access to a doctor, and there's an additional fee. And then there's what we do is a benefit, where for one small monthly fee, you have unlimited access to a doctor at no additional cost. So I just wanted to really kind of clarify that on the onset of this call, that telehealth is not telehealth is not telehealth. So you really need to look at the plan when you're looking at telehealth and determine, am I getting actual benefit for this monthly fee, or is there going to be an additional fee once we access that doctor? And again, both are beneficial. It's just important to know, especially for your employees, if they're expecting to have benefit and then they have access. A lot of times there's ill feelings when they have to pay additional to actually have the consultation with the doctor. So now there's a few little bullet points here that I want to talk about that not only have we experienced firsthand with our clients, but you'll see this a lot when you're researching telehealth as far as the benefits of telehealth. So there are studies that show employees that have access to telehealth program, they will miss fewer days of work, and generally they're less likely to put off going to the doctor to address a minor illness that could, if untreated, lead to something more serious. And the reason we say that is that, say on a Sunday, an employee's not feeling well, a lot of times if a clinic isn't open, they're going to have to wait till Monday. And perhaps they start feeling worse and or obviously maybe miss a day of work on Monday. Whereas if they have direct access to telehealth, many times there is no resistance. They don't have to set an appointment. They don't have to get in their car and wait at a clinic in a waiting room and worry about getting sick in the waiting room. So what they'll do is they'll just call the 800 number and they'll talk to the doctor on that day. Our telehealth, for example, is 24/7, and many are. So they can call right when they start feeling bad. And as like anything else, if you catch it early, a lot of times you can more effectively treat it. So I think that's important to understand when you're looking to add a telehealth benefit, is it can actually reduce time off from employees. Now, the utilization rates or the usage of telehealth, oftentimes what we see is with a new client, it will be slow at first as far as utilization or usage because people are just not accustomed to using it. But what we see is that benefit tends to kind of spread like wildfire throughout the organization once a few people use it. What will happen is one coworker will share it with another coworker, and they'll say, wow, this was really neat. I just called from my house and I was able to talk to a doctor. He prescribed some medication. They sent it to they sent the prescription to a local pharmacy. I was able to go pick it up within a short amount of time, and I was back home, able to take my medication and on my way to starting to feel better. And when that happens, we see the normal utilization increase on two fronts. One, the longer an employer offers it to an employee, the longer we have a client with us, we see that utilization increase. And we also see it, of course, during like flu and cold season. A lot of people will learn that this is really convenient. They want to knock it out. Whereas maybe they, in the past, they would hesitate to go to a clinic and kind of tough it out, if you will. And in this case, what we see is we see people calling in quicker to get that medication, just to get on the road to recovery. And a lot of times too, what that does is it prevents the illness from getting worse. And so I think that's a win-win for everybody, the employer and the employee. The last bullet point here talks about telehealth benefits are tremendous value for employees, given that it's typically a small dollar amount per month. So again, there's not a resistance from signing up or enrolling. And typically we don't see a resistance in usage because they can do it from the comfort of their own home. And we think, we see it firsthand in the last several years. The pandemic really brought telehealth to the forefront because of the environment that we were in. Many clinics were closed, and obviously people did not stop getting sick. So we saw a huge surge, certainly in our business, and I think across the board in telehealth with the utilization. People had not a lot of options. If they wanted to seek a consultation from a doctor, a lot of plans began to include telehealth, which was a good way to kind of thrust telehealth into the industry a little quicker than it might have been. And certainly nobody wanted a pandemic to have that happen, but that's maybe one of the benefits that came out of it is the awareness and then the knowledge of telehealth. Now, a lot of people think that healthcare in general is challenged and it's broken, and there's a lot of things that are difficult with healthcare because of the rising cost of healthcare, and that's certainly true. That's one other thing that I think we look at when you look at a problem and then you look at a solution. A lot of people in the telehealth industry feel like telehealth is a big solution to the healthcare industry because the problem that we're seeing is healthcare insurance premiums are escalating, deductibles are increasing dramatically. You're seeing more what they refer to as catastrophic plans because the benefits have become so expensive and the premiums and the deductibles have become so high. People have started to look at catastrophic plans, which are plans with extremely high deductibles, and they're hoping that they don't have to use their insurance or they avoid using their insurance. Whereas with telehealth, the utilization is very, very high because of that low premium and because of the ease of use. So we do feel that telehealth does offer a great solution, especially to the mid and smaller size companies that might have no other health insurance or may have health insurance, but again, may have high deductible. So with that, I want to continue with kind of discussing more of the solution. Again, it talks about the healthcare plan that provides affordable healthcare access to the employers, families, and individuals. So this is not only for, individuals. It can be, we have individual plus one plans. And you'll see as we have a lot of family plans out there. So again, a lot of times telehealth, even though if it's signed up by the individual employee, it can include a spouse and or a dependent and or the entire family. So again, just utilizing that across the board is very helpful and beneficial. A lot of times people think, well, so I'm going to be visiting the doctor over the phone. How much really can he do? How much can he tell? So the common statistic, if you will, in the healthcare industry is 70% of all minor illnesses and even minor injuries can be treated over the phone. So you see a small list here of conditions that can be safely diagnosed over the phone. Bronchitis, colds and flu, pink eye, earaches, ear infections, sinus infections, strep throat, a UTI, any sprains, and then minor illnesses and minor injuries are really kind of limitless. What we see a lot of times, especially since with our telehealth, there is no fee to speak with a doctor. We see maybe young mothers using it almost as a call-in nurse, where you do have the benefit of speaking with a certified and licensed practitioner or physician. So you're talking with a doctor, but they can a lot of times just ease the anxiety of maybe a young first-time mother who has a young one with a child with a temperature. They can get information that they wouldn't be able to get unless they took that baby to the doctor. Or if sometimes when in doubt, a lot of times we get calls and they'll speak with a doctor and that can ease them throughout the night. And even if it is something that a doctor isn't comfortable diagnosing over the phone, obviously if you cut your finger, for example, you're not going to be able to get stitches over the phone. So that would be one where a person would need to go to a clinic, a live clinic. But what can happen sometimes, and I didn't even realize this until more recently, there's a lot of recommendations made even for, say, dental care. If somebody is experiencing something, they can call in, talk to the doctor at no fee. And sometimes a doctor can prescribe a basic amoxicillin or a basic infection medication. That's very helpful. They can begin to take it right away. Or if nothing else, like I said, the doctor can prescribe or not prescribe, can make recommendations that will help that person span that time until the next day if needed. Now, what you'll see is the 70% of diagnosis that doctors can make over the phone that suggests that there's approximately 30% of times where a doctor may say that they'd prefer you be seen in person, maybe based on your symptoms. It's serious enough where a doctor does not want to diagnose that over the phone or wants a person to be seen in person. And again, There are options, at least with Convenient Care Plus, where we have a plan, actually two plans that include live clinic visits. So while a lot of things can be taken care of over the phone by a doctor consultation, some things they're going to recommend you be seen in a live clinic atmosphere or environment. And again, for those, we have plan options for those. Otherwise, at least if you have a telehealth only benefit, you're going to be able to, you, your spouse, your dependents are going to be able to utilize the telehealth for many of the minor illness and minor injuries, which is just a savings of time. And again, we don't see any resistance, and we see people seeking that help quite readily. And that's always a good thing, to seek care before it gets too far. I'm going to just go ahead and show this slide for everybody can kind of read this. And really what it amounts to is this illustrates the top 50 telehealth diagnoses. And I think what I want to kind of impress upon everybody is it is typically many, many more things than one would think of that could be diagnosed over the phone. Yeah, obviously, doctors have been trained to make diagnoses mainly through just talking with somebody, understanding what they're feeling, how they're feeling, asking questions. And that can be done whether you're present in an office and or over the phone. So that is why we like to open people's minds to this list here, giving people an idea that there's so many things that can be diagnosed this day and age by a doctor over the phone, hopefully giving people a sense that telehealth is really of value, opposed to there's just a handful of things that maybe a doctor can diagnose over the phone, when in reality there are many, many more. This slide is just going to illustrate if you were not to have telehealth, what telehealth could potentially save somebody if they had it versus if they didn't, obviously. So basically, if you had acute bronchitis, if you had a very bad case of bronchitis and it's after hours and the urgent cares are not open, you're going to spend, and to be honest with you, these are not so much outdated, but these are really, these can vary greatly from state to state and even from city to city. So where maybe in a rural area, you could see a doctor in an emergency room after hours scenario when you're having a hard time breathing for maybe $600. That very same ER visit could be $1,500 in a bigger city very easily. So these are probably very conservative cost savings, if you will. So it basically says acute bronchitis, if you have to go to the emergency room, it's around $600. If you go to urgent care, that clinic visit will cost around $120. Whereas if you had telehealth and you were able to pick up the phone and talk to a doctor, very likely he'd be able to diagnose that over the phone and be able to send a prescription to a local pharmacy in your area. So again, it goes through just some of these top telehealth diagnosed illnesses that we see every day, quite frankly. The strep throat, the sinusitis, bronchitis, any upper respiratory infection, flu type symptoms. You can see where the telehealth is really a big savings, even if you have insurance. Again, there's no deductible to be able to, talk to a doctor over the phone. This is just my contact, and I'm sure that'll be made available as well to everybody attending in case you have beyond today follow-up questions, or you get to the point where you start to talk about it with other staff members and or your management team, and you really want to look hard at offering this, and you have some one-on-one questions. I'm always more than willing to set up a conference call or a Zoom call and walk you through it and answer any questions, whether it be with our benefit or any telehealth or telemedicine benefit, just generally. I'd be more than happy to be your resource in that regard. So with that, I know that we wanted to leave some time here. I think we're about 25 minutes into this, and we wanted to leave some time for questions and answers. And so I'll kind of defer back to Lori to see if there's anything queued up at this point for questions.
Yeah, and I think I'm actually going to ask the
Oh,
question.
okay, Maya. Excellent.
So
Sorry.
our first question says, how has COVID impacted response time for telehealth?
Well, that's a great question. Now, again, I want to be more educational than a commercial here, but I have a hard time not using our particular scenario firsthand because it was what we experienced. So what happened in March of 2020, when everybody was kind of sent home, if you will, we saw telehealth utilization surge almost immediately with our existing clients. Then what we saw was many more companies come on board because when clinics were closed, they were not able to go, obviously, and they needed to be able to speak with a doctor. Now, we did experience, like a lot of telehealth companies, I think a short reaction time to that, meaning that we were seeing ours is typically within 10 minutes you're talking to a doctor. So again, try not to tout ours too much here, but we have nurses, RNs that answer every one of our calls. So they're able to get the, confirm membership. They're able to talk with the member about their current symptoms. And a lot of times talking to an RN is very helpful. So they were able to get immediate interaction with at least an RN in our case. And then we had to add many, many more doctors to our contract that would be willing to take our telehealth calls. So we had about 3 weeks there where we went into the 30-minute range, whereas I know a lot of other ones were exceeding an hour to be able to speak with a doctor. So that's a great question. But I think because of the pandemic, a lot of telehealth companies shifted the way they did it, maybe brought a lot more doctors on contract so that if we do see surges in the future, and we see it during cold and flu season, we'll see surges. And so we need to be ready for those. And we really want to keep our customer waiting as little time. It's one thing when you call a big box store and you're on hold, that's frustrating. But when you're not feeling well, that's really frustrating and inconvenient. So we really try to keep those. So back to the question was, it did delay our clients a little bit, but only for a matter of minutes. And I think we came full circle with that since that time.
That's awesome. Thank you. The next question that we have is, sorry, I just have to scroll back up. And before I tell you the next question, if there are any other questions as he's talking and answering these, feel free to keep putting them in the question and answer. We do have some time to answer them right now. So keep putting them in the chat. That would be awesome. So our next question for you, Kelly, is there a limited amount of time that I'm able to talk to a doctor? I know you can do it as many, like the actual time you're chatting with the doctor, is that limited?
That's a great question. So not so much how many times maybe in a given month can I speak with a doctor, because we talked about, at least in our case, it's unlimited. Now, just from an educational standpoint, understand on that front too, some of the telehealth providers will limit the number of times you can speak with them at no cost. Sometimes it can be, the first time each month there's no cost, then it will be $29.99 or what have you. But I think what they're asking is, once you're on the phone with the doctor, is there a limit in how long? I've not seen it at all. And I think our doctors that we have on contract are really, really good about that. They understand this is that person's time. And again, because the calls generally are short in nature, because they center around minor illnesses, minor injuries, things that these doctors do every single day, all day. They're very good at diagnosing these things. So the doctor, I've not had any experience, nor have we seen in any of our surveys that we've done, and we do monthly surveys, that we see I felt rushed by the doctor. There's none of that. I think the doctors for the most part, within our organization, are more than willing to sit and talk. I think because they're not in a clinic atmosphere, they're not having to go from office to office, walk around a clinic, and it just offers a lot more time. There's not a lot of downtime. So I think it does provide for a lengthy visit if needed. And again, though, not to be misleading, I think a lot of these are relatively short calls, but I'm sure some of them get a little bit longer, but our doctors have that time to spend if needed.
Excellent. Perfect. Thanks. Our next question is, the calls to telehealth over the phone, are they only with a smartphone using video? And I did see another one that kind of tagged on that said, could a telehealth doctor view a patient through a Zoom style call? So kind of a twofold.
Yeah. So remember I said that in our case, the member will speak with an RN first. And when they do that, they're confirming, date of birth, they're confirming some basic information of membership, and then they go right into the symptoms. And a lot of times the RN will determine based on the symptoms that the members presenting at that time, whether it can be just a telephone call. And I will tell you, the vast majority are just telephone calls, but they do have the ability to FaceTime, and they have the ability to do a Zoom type of call. Those are arranged though. And so what I mean by that is, if it's a telephone call, that member can expect a call back within minutes of making that call to the nurse. The doctor will then call that member back. That's how that works. If it's going to be a Zoom call and or even a FaceTime call, that's coordinated, and maybe one doctor isn't set up for that, but another doctor is. So sometimes that's where you run into your 15 to 20 to 30 minute callback time frame, is when they're having to, and sometimes a language barrier or different things like that will be the same, where it's available, but it's going to take a little more time to coordinate with the right doctor to make that call.
Okay, excellent. Someone here is asking about the cost of plans and how this is working through the AAFD.
Okay. Now I'll attempt to do this. I'm not sure I'll have a lot of success doing it. I had a one pager up here a little earlier.
And we'll send that out too for everyone.
You will?
Yeah,
okay.
So they will get that. Yeah.
So let me give just some broad maybe information for now. And then what they can do is refer to that one pager. And by all means, of course, my information will be made available that they can email or call as well for very specific questions. But generally, we will start our individual plans at $15 a month. Okay. So for $15, and again, I've always said that sometimes we have the little bit of too good to be true or around that, because for $15, sometimes it's hard. The old cliche is out there, you get what you pay for. And it's hard to really believe that for $15, you're going to be able to at any time talk to a doctor 24/7, 365. And again, whether you're at work, at home, or on vacation in another state, you can talk to a doctor. And with our program, again, you get not only the unlimited visits with a doctor, we have a pretty lengthy list of medication that is at no additional cost with that plan. So going back to that, it will start at the $15. And even for family plans, they can go up to $30 a month, and maybe up to $55 with multiple people in your family. But again, when you're talking about not only access, but true benefit with talking to a doctor and medication built in, that's pretty reasonable per monthly cost.
So the next question is, can laboratory tests be part of telehealth?
Well, going back to the educational part of this webinar, and not just maybe our plan that we offer through the AAFD, there are telehealth providers that have lab services. I haven't seen many, and I've seen some offer and then retract. So I'm not sure how effective that's been. I know that there's a large telehealth company now that does own a lab that is offering some of those services. But generally speaking, because telehealth is done just over the phone or over Zoom or over, FaceTime, the lab is not necessarily part of general telehealth. The other thing I wanted to say about the pandemic, telehealth really became kind of a confusing term during that time, because many of us in the telehealth industry who offer telehealth benefits felt we are telehealth. What we do is offer telehealth. Well, then all of a sudden, family doctors said we now offer telehealth. And what essentially they were doing is using that term to say we're going to offer our services via telecommunication. And if it's pandemic, you can't come to our office, we're going to talk to you over the phone. So that is in fact telehealth, but it's with your family doctor, not a separate plan, not a telehealth exclusive plan. So hopefully that's not confusing, but that's how telehealth is being used this day and age too.
Excellent, thank you. The next question is, are there any concerns or studies regarding the quality of healthcare and treatments between telehealth and the traditional in-person care?
Yeah, telehealth companies like us were pretty bullish on touting those studies because a lot of times you'll hear, and this was way before telehealth started, I went to see my doctor and the doctor was in the room for like 30 seconds and he walked out. I can't believe that, I had to pay for that visit. Well, what he was doing is he's using his years and years of experience, knowing exactly what that is by almost not even seeing that patient, by knowing what the symptoms are when he walks in the room. And that's really what telehealth is. And again, we're not doing, it's really, I want to be careful because we've had some really neat success stories with telehealth catching some very serious issues where a telehealth doctor will get that member directly to an urgent care or even to an ER when they hear symptoms. And that's the other beauty about telehealth, in my opinion, is that because people tend not to delay, and because there's no resistance of, I'm not having to set an appointment, I'm not having to take time off work, I'm not having to get in my car and drive across town, they will tend to call for nearly anything. And the reason that's so good is because, again, things can be caught early and very serious things can be caught by the telehealth doctor directing them to an urgent care and or to that. So I don't look at the quality at all of being substandard. I actually think it's the other side of it is where there's so many more things caught right away. And when a person doesn't think it's very serious and a doctor can tell them, hey, this is something you need to get to an urgent care right away for.
Sure, that makes a lot of sense. So our last question that we have here is, do most people use telehealth as a supplement to other health insurance plans since major incidents, examples, heart attack, would not be covered?
Yeah, boy, I hate to keep saying good questions, but those are really, they should be part of my presentation, quite frankly, because it's such good information to make sure we share on this call. So phrase it again, because I don't want to, I was going to start answering it in a certain way. I want to pinpoint the question though.
Yep, so the question says, do most people use telehealth as a supplement to other health insurance plans since, major incidences like heart attacks or something like that would not be covered?
Yeah, so we see a little bit of everything. We know that our plan works beautifully for smaller to mid-sized companies that don't offer any other healthcare. And for typically people that might be part-time or in a type of job that they don't have healthcare offered, we know our benefit is very beneficial there. Now, we see over the last 2 years, 3 years, specifically since the pandemic, when a lot of what happened was you saw a lot of people jump into telehealth. And then all of a sudden now you saw a lot of major medical providers adding telehealth as a piece of their offering. So then you saw, well, hold it, I have telehealth and I have major medical, so which one do I use? Obviously, the path of least resistance and no deductible. So many people gravitate toward telehealth. So it can be used as a supplemental to offset deductibles for that first dollar defense, they say. And, I'm in that situation. My wife has a job with a Fortune 500 company that we have major medical, and we have, in fact, we even have a different telehealth in addition to ours, because their large company offers a different telehealth, believe it or not, than ours. And so it's one that you use together as a supplement. Very easily you can do that. Now, I have to say this from a legal standpoint. There are some telehealth benefits that do not qualify to be used with major medical. And so we leave that up to the brokers and or to your HR director, and or for smaller companies, obviously they can contact, for example, me, and I can walk them through, hey, this plan can be used with this cannot. And so ours is a membership, so we kind of avoid a lot of that. It's literally like a gym membership where you pay per month per member, and it can be used with virtually any other plan. So but there are some guidance that sometimes is wise to seek when you're trying to pair plans together.
I think that was the last of our questions. So with that, I am going to formally thank Kelly and what you presented here, because again, it is a very cost-effective and efficient way to supplement your medical insurance. And again, my wife's a nurse, so some of the things that Kelly mentioned that he can't go too deep into, I can attest to from her own experience with the benefits of telehealth and just giving people another option to reach out quickly to a medical professional. Again, it's a very cost-effective and efficient way to do that. And again, Kelly, thank you for presenting to us today. We appreciate it. And it's just one more piece of an ongoing series that we have in the AFD. And I'm going to try and share my screen here. If you can see the upcoming webcast on May 3rd, I believe, not Maya, if you could just nod so I know, since I can't see the whole screen. May 3rd, we have What Are Your Business Priorities, hosted by Bank of America Franchise Solutions. So if you haven't registered for that yet, please do. If you have registered for the series, you'll be getting the notifications about that as well. But again, we thank you for joining us today. And again, another thank you to Kelly for what he presented, because it's a much needed, very effective way to support your healthcare, which is an important part of what we do as small businesses and franchisees. And not always can we find affordable methods to do that. So once again, thank you. Have a great day, and look forward to seeing you on the next one.
Thank you, everyone.